with over 9 million people. And yet we rank 10th in NIH support of all the states in the country. North Carolina is a flip. They are 10th in population, but they rank 7th in NIH support. And the reason is because they came together as a state and clustered their activity around Triangle Park and all the things that people know. Why can't we be number 7 or better? And I think that adding a brand to it does help, but the unit of analysis is important because is the unit the Northeast Ohio, or is it Ohio, or both? And I think it depends a lot on what you're talking about. And people from outside of Northeast Ohio don't realize, I came from Colorado, and I thought Northeast Ohio was just the eastern part of Ohio. I didn't realize it was a political, economic configuration. I didn't know it was a medical capital.
Welcome to our world.
Thank you. And so you come here and you realize what it is, but you need enough cluster, you need enough bulk, and critical mass. So the question is really, at what point do we brand ourselves as Northeast Ohio in the medical capital, if you will, and at what point do we take the state's resources and put them together and say, okay, this is Ohio putting itself forward. We want to be in the top tier, in this case, of medical research or whatever.
What would you recommend, Dr. Gershon?
I think we need to collaborate, not just with ourselves in Northeast Ohio, but to collaborate with the rest of the state. We can't ignore the fact that Ohio State, University of Cincinnati, Toledo, University of Athens, go down the whole list, also have resources. And the clinic and case are fabulous institutions. But alone, when you compare it to the whole country, it's less than the whole thing put together. And I know there is pride in, there's pride and identity that people have in their own institutions and their own regions. But sometimes we have to reach beyond the region if we're going to have the effect we want. And it comes back to everybody. Because if we put ourselves forward as, look, the $770 million in this state in NIH support. In North Carolina, there's $1.1 billion. So if we got to number 7, there'd be $300 million more. You multiply that out by a factor of 30, which is the indirect and direct job creation, and you have 10,000 jobs, high-paying jobs. That's good for Cleveland. It's good for Youngstown. It's good for Columbus. It's good for everybody. So the boat rises when everybody talks together.
Chris Coburn, I'll give you 30 more seconds, and then you have to leave.
India mentioned... my flight's at 1:30. It's the last flight. But India mentioned the Global Cardiovascular Innovation Center. Mark actually leads it, and he'll be up here in a moment. But I can't help but say there's 11 of the top 100 cardiovascular programs in the U.S. are in Ohio. And the vision of the GCIC was to tie them all together. So it does link Ohio State, UC, hospitals in other parts of the state, and of course a lot of companies. So I think there are many opportunities for us to do more of this, and the Austin Institute is another example on a regional basis. But I agree. I think the more Ohio is knit together, the better we all are.
Thanks, Chris. Chris is going to do a little microphone exchange. I'll introduce Mark in a moment. Ken Walker of Magnet.
I just had a comment in regards to what we get from the medical capital. I think when you think of medical, you think of healthcare, there's a connotation of cleanliness. And I think Cleveland and Northeast Ohio has a reputation as being smokestack industries. So I think that from the standpoint, if this catches on and this spreads out, what we'll have accomplished is being able to attract skilled workers to Ohio, being able to retain our own workers in Cleveland. We see articles in the Plain Dealer every other week about how there's a brain drain here in Cleveland, Ohio, how our young people are going to more supposedly exciting regions than Cleveland. But if we can have the connotation that these are high-paying jobs here as a result of the medical capital, these are clean jobs here for them to be involved with, I think we have a much higher opportunity to secure those folks and keep them here, as well as attract those skill levels here. And that, as this gentleman was saying, rises all boats in terms of what the skill levels are needed for our manufacturing base here in Ohio. One of the largest complaints that I get when I go to manufacturing companies is that we have jobs, but we just don't have the right skill sets as far as those people applying for the jobs. But if we have high-paying jobs that require high skills, high brain power, et cetera, those people that come here, if they don't necessarily find jobs in the medical capital area, will be able to find similar high-paying jobs in other industries here in Ohio as well.
Dr. Gershon.
And now we're on to a great topic, talent creation.
Yes.
Because underneath all of this is who are the people in the workforce and how do we attract those people? How do we provide more individuals an education that's going to contribute to this economy?
Let me ask you a context question about that before we jump into talent creation. A few years ago, I remember there was a story, or it seemed to be this trend where there were thousands of jobs available in healthcare, and the workforce was not there to take those jobs. And for some reason, these jobs, even as the recession was beginning, these jobs were going unfilled. Is there still that disconnect right now between jobs available and skilled workers available to fill them?
It depends on what jobs you're referring to. There's a projected shortage of 125,000 physicians by 2025.
Across the nation?
Across the nation, and 40,000 of those primary care physicians. So from the physician point of view, and if you look at healthcare reform, bringing 30 million more people on insurance rolls, and yet we're 40,000 short on primary care physicians. So, what's the mix of specialists and generalists? What happens to underserved neighborhoods that are not getting physicians because people are not practicing there? What is the diversity of the workforce, which is very important in terms of reaching out to the population and getting people to come in?
What about nurses and lab techs and phlebotomists and India? Go ahead.
One place that we can talk about, and just Friday, we had Bill Strickland here from Manchester Bidwell, and Cleveland will be the 4th replication site for what is Newbridge, Cleveland Center for Arts and Technology. And one component is working with the medical industry and training people as pharmaceutical techs and phlebotomists, and then long-term looking at some of the other market-driven needs of the institutions to figure out those jobs. They have had a long success rate with that across the country with Manchester Bidwell. So Cleveland will be opening its center, and the grand opening for anybody is November 4th from 4 to 6:30.
Okay, anybody else got a quick plug? No? Okay. Mark, maybe later. Mark Lowe, you're just joining us now from the Global Cardiovascular Innovation Center. Tell us, jump in here, at whatever level you'd like to.
Thanks very much. Well, first of all, let me just introduce the GCIC because it touches on many of the things that we've already talked about. It is a Ohio Third Frontier funded program to the tune of $60 million. It was established as a multi-institutional consortium, very much like the Akron Bioinnovation Center. We do have a statewide mandate, and not just a regional mandate, but much of what we do is located where there's the largest weight within the state in terms of activity. And our programs are to focus on cardiovascular new businesses, to either form them through funding programs, to attract them to the state from outside, and to incubate them. And we have programs that function in all of those different areas. We've been in business about 3 years now. I was recruited in from the medical device industry to lead it. And so my own personal story is that I've worked on both coasts in the medical device industry, but I came to Cleveland to do a lot of the work within the companies that I was working for at the time, to do product development and market evaluation for our products here at the Cleveland Clinic and at University Hospitals. So there is a basis for the concept that it is a center, that it is a capital that has recognition and that draws. And so it dragged us in.
Let me ask you this. When you talk to your colleagues across the nation, and when you trot this idea out for a test drive or whatever, will it fly? When you start referring to Ohio or Northeast Ohio, to this region as the medical capital in Silicon Valley, in New York City, in North Carolina, will they say yeah, or will they be like, what are you talking about?
I actually think that it can work, and I think it has to be built, like any brand has to be built, and you don't just get automatic recognition for that. But we do have recognition that, as India said, can be put into this framework. And I think that that's going to be a structure that will help us all. Because I have talked with my colleagues at the other, kind of acknowledged centers for medical device development around the country. Bay Area of San Francisco, Minneapolis, St. Paul, Boston. I came from Seattle. But when you talk about what's going on here, and they begin to appreciate the really visionary investment that's on the basis of the state, from the state, as well as from the institutions and all of our institutions working together, I have gotten a tremendous amount of feedback of jealousy for what is going on here.